Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and on with me today is Kameron Wescott and Kary Brittingham. You know them as the two stars of Bravo's Real Housewives of Dallas, and now they are doing their own podcast called Cam and Kary Do Dallas. Hello, ladies, and welcome to the show.
Hi, thanks for having us.
Yeah, we can't wait to hear all your real stories.
Well, we're excited to have you, and I can't wait to dive in and see what mischief we can create.
So tell us about you. We obviously kind of read a little bit about you.
Okay, well, it was all lies. I hope my publicist wrote nice things.
Let's
Yes, amazing things. And, we are just so excited because you have your podcast called Plastic Surgery Uncensored.
And I love that.
And we want to know everything uncensored right now because we got lots of questions for you.
Yes.
Great. Well, I have only one mode, and that's to tell you the truth. So that's probably why it's considered uncensored. Because, today it's all about what is appropriate, what sounds good, what's PC, what's going to bring me the most notoriety, what do people want to hear. The reality is that when you're a professional, a dentist, a lawyer, a doctor, you really should have only one mode, and that's just to tell it as it is. Now, you can be crass about it or you can be sensitive about it, but the truth is the truth. There's no alternative universe. So that's we will definitely have an uncensored conversation. I'm all yours. What do you want to know?
And that, believe me, that's so who I am. So this is amazing.
Yeah.
So what is I want to ask you something. What is the number one, procedure in plastic surgery that women get done and are not happy with?
Oh, wow. That's so many. I don't know if that I can answer that question exactly the way you had intended, which is number one is nose job or number one is tummy tuck. I can tell you that in general, or another way to think about it is, why are so many women unhappy with their results? And there's a host of things that lead to unhappy results, whether it's your nose or your breast dog, or I did my facelift or whatever. So what are the reasons? Number one, generally, is from a lack of research. So what is considered today, you want to go and get your spine operated on. My wife's had 4 spine surgeries. And what do? We did a lot of homework trying to find the best spine surgeon. How did we do it? Do you think my wife and I went to Instagram or TikTok? Do you think those are resources that we would consider as reputable? We sure as hell didn't go on TV and look for this guy or see who the celebrity. Oh, did you hear Justin Bieber went to this guy? No, we did regular old-fashioned homework. We went on major review sources. We read his education, etc. Today, plastic surgeons, nobody knows where their plastic surgeon went to school. They don't even know if their plastic surgeon went to school. They know that this plastic surgeon, Dr. Whoever, is really, really killing it on social media. They're all over. They have 2 million followers, 300,000 likes. All the influencers are going there. Mm-hmm. And so that is the way people are educating themselves about plastic surgeons, but they wouldn't do that for their gynecologist. They wouldn't do that for their spine surgeon.
Listen, plastic surgery is something that you can definitely it's something that you see, right? Like especially a nose job or a facelift or anything like that.
We want to look at pictures.
You want to look at pictures. I mean, for me, for example, I can research you all I want, but I like my number one thing is if I see someone that looks amazing after they had, a nose job or a facelift, I want to go to that person.
Sure.
It's word of mouth.
That's true, and your point is well made. Plastic surgery is very unique in that the outcomes are ultimately visual. But the fact of the matter is that 90% of the images you see on TikTok and Instagram are manipulated and morphed. They're not reality, the alternative universe. How many of the influencers do you know look like them images? They have body tune, face tune, video tune. When you go to my gallery on my website, remember those things called websites? There are over 2,000 photos. There are almost 500 noses. You can go see all the photos you like. I'm not suggesting that photos are not useful, but what I'm suggesting to you is that let me ask you something. That doctor you see on Instagram who's got this incredible before and after nose job, Does it matter to you at all that they're a dentist?
Oh, of course. I mean,
yeah.
of course
Okay.
I'm going to research
Yeah.
more than
Right.
just.
So where are you going to research them? On their website. You're going to check the California medical board. There's a million other things than influencers and likes that can be bought and manipulated. So the point I was making to you originally was, you said, well, what are the most common things that people are unhappy about? One of the things that leads to unhappiness is misleading information and misunderstanding the qualifications of your surgeon. Today, there is a ton of surgeons that are doing plastic surgery, which we call cosmetic surgery, that are not plastic surgeons. They're not board certified plastic surgeons. OBGYNs can do tummy tucks. ENTs, facial plastics, do breast tucks.
So on season 2, there's actually some controversy between 2 housewives because one of the housewives got her boobs done by an OBGYN. And it was lots of drama. And the other girl was confronting her saying, well, my husband's a doctor. He told me that doctor is an OBGYN. Why did he do your boobs? And, in reality, she got a free surgery if she advertised the situation.
And it showed, right? She had a lot of issues with it, and
She
it did
ended
not
up
look
getting
good.
an infection.
Yeah.
Right. So what the thing about it is that these are the things that we are all influenceable people. You, me, we have this microphone. People are listening to us. We could tell them whatever the hell we want. So one of the reasons why we were talking about how this all started is like, well, why are people unhappy? Which is just a very good question, rather than saying what makes people happy. We want to know what happens, what goes wrong, so that if you're listening, you're like, oh shit, I better avoid that.
Yeah.
And I think one of the biggest component is who the hell is doing your surgery. So who's doing your surgery is a doctor. And the question is, how the hell did you find that doctor? Well, I found that doctor because I did my homework. Where'd you do your homework? And that's the problem. If I go to the back of a Cracker Jack box to do my homework versus if I go to the Encyclopedia Britannica, the likelihood of me finding an amazing doctor who will then perform amazing surgery, who will then lead to an amazing outcome, is lesser. So my biggest issue today is not the surgeries, BBLs, this, that, is the people performing them and doing a shitty job.
Mhm.
And a lot of that information today, plastic surgery is super common, right? It's like not a big deal. Oh, I just had a little facelift. Oh, a little boob job. Whereas like 20 years ago, it was like a huge deal. So to answer your question long-winded, I think the biggest issue is just not doing adequate homework, because every guy or gal is now a plastic surgeon in disguise.
And what is your favorite procedure to do?
So I'm in a little bit of an anomaly in that I love to do them all. And the reason I love to do them all is that I spent 20 years training, and there's no way on earth you're going to see me every day doing the left nipple reduction. That's just not my training. I'm not an iron maker. I'm a very skilled surgeon who dedicated my life. So I already am subspecialized, because in plastic surgery, we train to do burns and breast cancer and craniofacial and all kinds of things. And I chose to dedicate my life to cosmetic aesthetic surgery. But within that, I want to do a nose job on Monday, then a facelift, then a tummy tuck and a breast aug. The reason people subspecialize is for marketing. They want to be my doctor. Oh, he specializes in only breast augs. Does that mean he's really good at it, or does that mean that's all he can do?
But you don't have a favorite?
My favorite thing to do is rhinoplasty.
Rhino, why is that? Is that when people see the most difference in themselves?
Partly, but I think without a doubt, it's the most difficult surgery to execute naturally and beautifully and skillfully. Breast augmentation requires fewer skill sets from your surgeon, but a rhinoplasty is one of those things as a surgeon that will constantly challenge you. And you'll see that if you go and talk to most plastic surgeons, only a very small percentage of them do noses, because it's just a miserable journey. But you can only do so many of them before you want to kill yourself.
Okay, so nose jobs are the hardest, and I guess boob jobs are the easiest.
Then the flip side is there is no easiest, right? Someone asked me a question on our podcast, which is a really good question. And the question was, and I've been in practice, shy of 20 years. And the question was, do you still get nervous when you operate? And the answer is absolutely. And the analogy that I made was, let's say you were a lion tamer. That's what you did. You were the guy who is in the circus with a lion. And the lion that you're taming, that you're doing the skits with or whatever the performance with, is a cub that you had when it was a little tiny little cub, and you fed it by bottle. So this cub and this lion and you have known each other for 30 years. The reality is that at the end of the day, it's still a lion. And the minute you become casual and very relaxed is the minute the lion eats you on stage. And so surgery is a thing that you need to constantly have respect for, because you go in, you're like, I've done 4,000 of these.
Yeah.
And sure enough, 4,001, and something horrific happens, because it's like really treacherous. So I don't have an easy, and I definitely have a hard.
Does it bother you when you see other doctors who are not as skilled or educated and trained as you gain all these Instagram followers and start creating all this traction when it's, based on, false advertising on Instagram, and they get this huge following, and you've been, working your butt off, and there's people following other people that are not as educated in the field. Does that drive doctors insane?
Yes, yes, yes. I think that's a very interesting question. And the truth is, it shouldn't, but it does.
Right.
And it does for two reasons. One, of course, is just a personal issue, but the greater issue is that you feel bad for these people. So, the first 10 years of my life was dedicated to what I refer to primary surgeries. Means people come in like, hi, I want a breast aug. Hi, I want my nose done. And believe it or not, the second decade of my practice has been dedicated to revisions. Most of what I do now is, I had my second nose job, or I had a breast aug and it went. And so you're thinking to yourself, these people. And then when you ask them the questions, you find out that they had these surgeries done by doc whoever, and this, that, the other. So you kind of feel bad, because someone is going to run down the street and fall into a ditch, and you can see them running towards the ditch, and you just kind of want to scream your head off, and you can't. You just got to wait till they fall in the ditch, and then they come to the hospital. So I think it's very true, and it does frustrate me. And the only thing I can do is get to the top of a rooftop and scream like I do in my podcast every week.
So I have a personal question, like for me. So, I'm 51, and I was, during the show, and it's funny because I now understand why so many celebrities are always, so big on plastic surgery, because you're constantly seeing yourself on TV and see all your like faults, right? I mean, more so than if in the mirror. It's just the weirdest thing.
Yeah.
So, since I started recording the show, I'm like, oh my gosh, I started noticing things about me, and I definitely feel like I want to have like a facelift. I feel like I'm 51, and I feel like, okay, I need to do something. Like, is there a certain like age or certain things that you say you recommend? Okay, when somebody really should do it? Is there like a magic like thing about that? Because that is the one thing that I've been like, uh, thinking about. And I have a lot of people that tell me, "Oh, Kary, you look so much younger than 51. You don't need a facelift." But I'm like, I sometimes I feel like I do, sometimes I don't. But what is your take on that?
I think you hit it right on the head. Plastic surgery has never been more popular than when COVID occurred. Why do you think that is? It's because of Zoom. It's because of teleconferencing. It's because people now look at themselves more than ever before on camera, and cameras are incredibly unforgiving. And so what you're stating is that Zoom effect on steroids, because all people, celebrities, athletes, whoever, who are being cameraed and filmed and angled and makeup and lighting, they're under a microscope.
Yeah.
And so it's not uncommon that a 51-year-old woman like you would be more critical than a 51-year-old woman who doesn't look at themselves on the camera. So that you got a check mark for. That's totally normal. The question you asked is 51 the right time? Am I being nuts? Am I, is this too is this too aggressive, too early? And then what's the magic? And the answer is, it's kind of complex. We used to do facial surgery, AKA facelifts, back in the day, much later. People got it in their 60s and 70s. You sort of waited till it looked pretty bad, and then when you went and did it. And because of culture and changing culture and our acceptance for things, That has changed. And now we do things younger because we want to look better and we demand more out of life. We have more images of younger looking older people, so it becomes desirable.
Mhm.
And now it's being presented as not a big deal. 20 years ago, a facelift was like, holy shit, you're getting a facelift? Oh my God. Now it's like, oh, I'm just going to get a little facelift. It's like lunchtime.
Yeah.
So that package that I described is the reason why you're like, Now, it turns out that 50 is right around the time that you start to see the changes that you didn't see at 40.
I already see stuff.
Oh,
I'm not
stop
40
it.
yet, and this is looser.
So the things that you're going to see are, by the way, you and me and every other person in the world ages exactly the same way. It's just at different times. The three things you see is you start to see a little bit of loosening in the neck.
Yeah.
What I started seeing on the show.
See it right here?
I started seeing
Right.
this little thing.
You see a little bit of jowling, which is this part starts coming down. And then you see a little marionetting, which is this line starts to get deeper. So you get a marionette, that's this line.
Mhm.
You get a little jowl, which is this looseness in the jaw. And then you get a little flabbiness under the neck. And that happens when? Right around 50, 48, 51, 53. That's when it happens. So it is natural for you, who's on camera 24 hours a day, who is a pretty woman, who's used to looking great, who's looking at images, to question this. And the answer is it's not unreasonable.
And recently divorced. So now
Oh, that takes it to a whole new level. We got to get you in the game, girl.
I know. I'm like 911. I need help.
No. So the truth is, when you do this facelift that you're describing, and I hate the term, but it's a mini lift. And the reason I hate the term is it's been designed to minimize it so you're like okay with it. It's a facelift, but you don't have as much loose skin as your mom who's 75.
Mhm.
And so the amount of work that we do, it's the same surgery, but we do less of it.
Is that good to do a mini lift versus wait for a full facelift? Is it better just do the little one earlier before it gets too worse?
So that's a great question. Do you drive around and just barely make it to the gas station because you're waiting for the gas to run out before you waste time to go get gas? Or do you drive and see your tank go down to a quarter, see a good deal and say, fuck it, I'm going to go and fill up my tank? That's a personality. Some people are like, there ain't no way I'm going to look like my mom. Hell no. I am going to look my best. My wife's one of them. She's 31. She wants a facelift because she's like, I don't want to look bad. And there's some people who are like, I'm not going to do anything I don't have to do unless I have to do it.
So like if I do that mini facelift right now, I mean, that means like, okay, so I'm going to look, like 5 years younger, 10 years younger, or it's not about looking younger.
It's not about looking younger or number of years. It's like looking you. You're you, but you just look a little snugger and a little fresher. Oh, did you lose weight? You look good. Did you color your hair? It's one of those subtle improvements. If someone looks at you and says, holy shit, what happened to you? Then that was a bad surgery.
Yeah. So does that like mini lift, does it last for like 10, like you have to redo it again in 10 years?
It depends. Did you gain 30 pounds and then lose 40 pounds and then start smoking every day and then become an alcoholic? Did you end up eating an incredibly good lifestyle, stay out of the sun and not change weight? So these things that people hear there's a difference between what happens and what's being sold to you as consumers. We have to package it nicely for us to sell it to you. So we say facelifts last 7 years. They make you 5 years younger. These are all terms that everyone uses because that's what we sell to you as a society. But the truth is, it depends. But one thing's for sure, assuming your surgeon does a good job, you'll look great for a period of time.
Now, for someone my age, I'll be 40 next year. What are things I can do to keep, preventing my face from dropping? And, what can early 40-year-olds do to look fresh?
Or your boobs?
Yes.
Yeah,
yes.
maybe we should show him our boobs and see if he.
Are we talking about face? So before we flash me, hold tight. So you were talking about 40-year-olds and what can they do
Yeah.
to prevent things before we move to your
I'm
breast. Because
all about prevention. Like I started Botox really young because I had a line on my forehead, and I started really young because I did not want that line to get deeper. And the dermatologist was like, "Well, let's prevent it from getting deeper. So let me put something in." And my mom was like, "Why are you doing Botox at 24?" But I'm like, "Sorry, like I didn't want it to get worse."
yeah, I think so. So here we go. Here's my list. First of all, we're going to use the word delay versus than prevent. I'm a big fan of delayed things. You are going to 1000% become a wrinkly prune. The question is, will it be at 115 or will it be at 67? So we're not going to prevent anything.
We are never becoming.
Yeah, never. Yes, in the alternative universe, you're going to go to the next life.
With
we
the
will-
frozen face.
We will be
Yeah.
in denial forever.
Yeah.
So the question is, what are the things that I can do to delay the inevitable?
Yes.
So Botox is fantastic. I had a girl who came into my office today. She was 26. She has very few wrinkles. The reason to do Botox is not because we're treating her wrinkles.
Mhm.
The reason to do her Botox is we want her to slow down the formation of the wrinkles. If she came in at 45, we were treating the wrinkles. They're there. We want to make them less. If she comes at 26, we want to not let them get there. So one thing I really am a big fan of is small doses of Botox in younger people. The next thing you can do is you can cover your face up like it's a porcelain doll. The thing that causes the most aging in people
Son.
is sun damage. And what do we love when we're in our 20s, 30s, and 40s? We love to be in the sun. We want to go outside, pool parties, dress summer dresses.
I'm always under an umbrella, by the way.
Right. So
Always.
I'm
not. I'm the worst.
So I'm like so pale.
I'm Latin. I'm
Yeah.
in the sun all the time, and it's horrible. Like I'm just so scared.
So sun damage, the reason why sun is heat. Heat is energy. Energy fries, cooks the cells, loosens the skin,
Cooks the cells.
and then gives you sunspots. And so that is one very big component of causing fine wrinkles and sagging, etc.
Yeah.
The next thing is lifestyle. So alcohol, drinking, smoking, those kinds of things. So they are going to impact your skin.
And I'm surprised I don't look like I'm 150.
Yeah.
You look amazing, but just imagine you would look like you were 6 if you didn't.
I mean,
You know what?
Her
I think I'd rather
genes.
have all the fun that I've had than look like I'm sick.
Perfect. That's exactly, you choose it for you. And the last item actually that is people don't realize it is fluctuations in weight. So it makes a big difference. And so what happens is if you're very thin, your face will sag. If you're overweight and then you lose weight, your face will sag. So we want to try to identify a weight that we like, that we feel healthy. Like, I feel good here. This is my good weight. And then kind of just hang out there rather than doing these yo-yo things. Other than that, the rest of it is treatment. Like, my eyelids are sagging, fix it. My eyebrows are sagging, fix it. But those are the things you can kind of do to make life not get so bad.
So I've heard that having a lot of sex also kind of keeps you younger. Is that true?
Absolutely, 100%. The
I
more,
know-
the merrier.
that's not a rumor. That's
No,
true.
it's true. I have heard that, and also I've heard that
What?
if a guy like comes and you put their cum on your face, it's kind of like a facelift.
No.
Well, it's a facelift only in that it gets sticky and then your face can't really move.
Well, someone told me if you swallow it, that it makes you younger, and I said that's not happening. I was
I
like,
bet you I know who that someone was.
That
that's not happening.
that would be a lot of vitamins.
Not happening.
That's the number one thing men tell women. It's never a woman telling a woman. It's a man telling a woman. That's for sure.
Yeah.
Roddy,
yeah.
you know you're not gonna get away
Smarter than that one.
without us saying something inappropriate.
She's always inappropriate.
I'm
one.
always
It's okay. It's the Latina throwing the fireballs.
Yes. She likes to make people feel uncomfortable.
Well, I haven't flinched an eyelash.
not you. This one over here.
Yeah. So question. Okay. So Kim Kardashian, let's talk about
Mhm.
her.
I'll
Okay.
call you mom.
How is her butt so big and her waist so tiny?
Number one, she's had multiple rounds of BBL.
What's BBL?
What's BBL?
BBL is Brazilian butt lift, also known as fat transfer. So this surgery's been around for a long time, but it was super, super, super popularized in the last decade. And what it entails and has caused the most number of deaths in plastic surgery in the last 50 years.
Wait,
No.
what?
Yes, it has. What it is you go in,
God.
you have them suck out as much fat from around your body,
Mhm.
arms, legs, back, stomach, etc., but predominantly from your waist. And then you take all that fat, you prepare it, and then inject it all into your butt.
Yeah.
And so what you're getting is a few things. One, you're getting a much larger butt. Two, you're getting a so-called hourglass because they sucked it out of your waist. And this
No.
BBL has just literally exploded.
Oh yeah.
And it is now the number one procedure probably in the world.
Do you
Now,
do you do it?
not really. And I'll tell you why.
I mean, is that what
Well,
your
I've
butt-
seen all my friends lately in the gym and their butts are so big now. I'm like, what happened?
Wait, is that what they can do the jiggly thing, the dance? That
Oh, what is it called when you shake your butt?
I know.
Twerking?
Twerking, yes.
Yeah.
That's what
Why do I know that and you guys don't?
Yeah.
that is a situation.
Yeah,
Okay,
she should know that. I definitely
I've been trying to learn how to
very
twerk, but
sheltered.
I guess my butt is not wiggly.
I can't twerk for the life.
So that BBL, the reason why it caused so many deaths was that when they, so again, like all things, so people found this procedure to be desirable. You're a young girl, you want that curvy. It's often cultural, certain cultures, Latinas, et cetera, et cetera. It's very desirable and popular. Sometimes it's an expensive procedure. You go to less desirable places, clinics, et cetera.
Oh.
And when that fat is injected, if it's injected too deep and into the muscle, the fat goes into the arteries and veins and cause emboli, and people drop dead.
Oh my
No.
gosh, that is
So,
crazy.
so that is one of the things that she's done. Has she publicized it? No, but we know for a fact because it's just no way. And the other is it's possible that after you do that, you then can, in addition, add an implant if you are so desired. Like, oh, it's not big enough, I want to be bigger. So those two items together can make the most ginormous butt you've ever seen. And naturally, if you start out with an okay rib cage or waist, you're going to look really curvy.
Or
right?
like an
Wow.
implant, like the same thing that you would use as a breast implant.
The breast implant is different because it's soft and squishy. The butt implant is a solid silicone implant because remember, you don't sit on your breast, you sit on your butt.
Wow.
So,
Oh,
yes.
wow.
We're going to take a quick break and we'll be back with more on Cam and Kary coming up next. All right, we're back with Cameron Wescott and Kary Brittingham, stars of Bravo's Real Housewives of Dallas and the hosts of their popular podcast called Cam and Kary Do Dallas. All right, welcome back, ladies. Let's get into this thing together.
I have a random question. So I noticed when I get Botox in Beverly Hills, it is a lot more expensive than it is in Dallas.
Mhm.
And I go to probably, I want to say is the best in Dallas, right? And
Of
why
course.
is it more expensive? Is it just because of your guys' rent?
Yeah, of course. No, I mean that's the same thing as like saying I live in a beautiful 10,000 square foot house that's half the cost of what it is in Beverly Hills. The cost of living in Beverly Hills, hence the rent, hence the staff, hence the insurance, is outrageous.
Gotcha.
That's one of the main components, and the other is people. They're celebrity doctors, and when you become a quote unquote celebrity doctor, you can just pull a number out of your ass. How much is Botox? $10. How much is it in Beverly Hills? $20. How much is your celebrity doctor? $100. Why? Because I said so.
Okay, question. How many times can you have lipo?
The reason I don't do BBLs, as you asked, is because I hate lipo. The reason I hate lipo is that lipo almost always leads to a shitty result. Now, let me explain you why. You go in there with a cannula, which is a long straw, and you suck out, and I don't mean that with your mouth, but with a machine, little globulates of fat from the legs, from the belly, from the back, from the arms. You create little dents, and then you pray to God that the skin becomes nice and tight and smooth. And it doesn't.
Mm.
And it looks okay for 2-3 months because it's swollen. Let's talk after 2 years. And when you talk after 2 years, two things will happen 100% of the times. You will have irregularities like Terror Banks. Your skin will be little lumpy like the cobblestones of Rome. And your skin will be kind of shitty because it's not tight anymore. So this idea that liposuction makes this same gorgeous body you have, but slightly smaller, is nothing but bullshit. So I don't like liposuction. I would do it every day if I thought the results would be amazing, because I have people lined up outside the door.
Right.
But I think the results are at best mediocre. So to answer your question, you can liposuction 100 times, but you're going to keep creating more damage, more dents, more fat is gone. So it's just a shitty procedure.
Oh, okay. So if someone walks in and they're chunky and they're like, I want to get skinny, what are you going to say to them?
I tell them, you need to lose weight. I am incredibly transparent with the patients. I do it with incredible sensitivity, because I know that people are not stupid. When they're 5'6", they've had 3 kids, and they weigh 195, they're not dumb. They understand that for their body weight, they're overweight. They're having a hard time. It's hard to lose weight. You have metabolic issues. You're not as excited about life, blah, blah, blah. But I should not take advantage, nor do I, of that situation, because at the end of the day, I'll take their money, I'll do their surgery, and they'll look,
Okay.
They won't even look, They'll be like, And so what they need to do is they need to lose some weight.
Yeah.
They don't need to be 125 pounds and have this skinny little body. They need to lose weight so that I can do the surgery.
Mm-hmm.
We help them lose weight because we give them ideas of nutrition and how to get their life back on track.
And then you do like a tummy tuck or something without the lipo then.
If they need a little lipo for contouring, I have no problem. I don't do lipoing because you're overweight and you want to be skinny. Liposuction is designed for contouring. That means fine sandpaper.
Oh, wow. Okay.
So I have a question. A friend of mine, about, oh my gosh, last year, she had a tummy tuck. Okay.
Mhm.
And I mean, I looked at her, I was like, you don't need a tummy tuck. I mean, it was one of those things. She's almost kind of addicted to plastic surgery. She gets a lot of things done. So she had a tummy tuck. But the weird thing is like she had a tummy tuck. So she has this scar across her body, right? But then she has this scar that went up towards her belly.
That's right, because she didn't have enough skin.
So
What?
yeah, I
Oh,
saw it and I was like,
no.
so now she can, like, we went on a vacation
Ooh.
and now she kind of wear bathing suits and she's so unhappy with it. She regrets it so much. I mean, would you as a plastic surgeon, you would have been like, no, there's no way you can do this?
This is now you're getting into the integrity of physicians and why I'm so frustrated with this goddamn new world we live in. Someone comes into you and says, hey, I want whatever. And you look at them and you know better. And you're a well-trained surgeon. You go like, listen, I would love to help you. I need your money. My rent's very expensive. I have 2 kids in college, but this is a stupid idea. You'll be unhappy. That's our job. So the reality is that you would think, quote unquote, that a doctor, how could he do that? Well, what do you priests are molesting kids. What do you mean? Police officers are beating civilians. I mean, you think that people are somehow magically moral when they're doing jobs like doctor, police officer, firefighter, teacher, nanny. They're not. They're regular people, and there's sick people everywhere, and they're greedy.
So that is a bad doctor.
No, not necessarily. No. Because if you go on my gallery, there are patients who need a little vertical line. You need to educate the patient as to what they're getting so they make the choice. So here are 2 examples. One example is it's a terrible idea, don't do it. And one example is here is what you're going to end up having. It's arguable if it's better or worse. And then it's my job to tell you, here is the apple and here is the orange. Make sure when you pick the apple, you don't think you're getting an orange. Sometimes patients are devastated because they thought they were getting an orange and they were sold an apple. You understand what I'm getting at? So what I spend an hour in a consult. What the hell do I need to spend an hour in a consult for? I can do your consult in 6 minutes. I spend an hour because I'm trying to teach you the difference between an apple and an orange. So that when you walk out and you're like, I'm ready. Yoo-hoo, I'm ready. I'm going to do this. You know what the hell you're talking about.
Yeah.
Yeah.
A lot of people always ask me, online, like, oh, do you do anything to remove your cellulite? Because I don't have cellulite, but people always ask, like, is there anything Is there anything people can do to remove cellulite?
So there are three things that if I figured out, or any surgeon or any doctor figured out in the world to fix, they would be trillionaires. And every human being on the planet would know about it. And nobody would have to figure out whether or not it's doable or not, because it would be so obvious. It would be like Kleenex. Number one is removal of cellulite. There is none, zero treatment for cellulite that if you did it, you would walk out and be like, wow, I look good. Because again, if there was, it wouldn't be a secret. There are hundreds of millions of women who would spend hundreds of thousands of dollars to get rid of it. So the fact that someone's like, hey, I hope there's some, it would be all over the place. The second thing that I would be a trillionaire for is getting rid of stretch marks.
Oh, yes.
If I could get rid of stretch marks, I would not be on this show. I would be on my yacht. And the third, drum roll, is scarless surgery. How do I do my breast aug? How do I do my tummy tuck? How do I do my breast reduction without a scar? Can you get rid of my scar? How about lasers? How about creams? How about blah, blah, blah? How about sand from the Sahara Desert? If there was a way for me to get rid of your scar, your C-section scar, your gallbladder, you don't think I would have a line from here to Dallas with people in my office? I would not be shy about it. I wouldn't even operate another day. I'd hire 30 women. I lied. I have 4. Oh my God, I have another one. The last one is skin tightening. Skin tightening, non-surgical skin tightening. Hey, Dr. Rahban, I have loose skin on my arms. I have a little bit of bat wings. Can you use a machine to get rid of it? No. Hey, Dr. Rahban, I have a little bit of loose skin on my inner thighs. Can you tighten it for me? No. The only way you get rid of loose skin is cutting it out. Anywho, I'm a skeptic until proven otherwise.
Okay, so what about Chibala? Wait, what's that thing called?
Kybella.
Yeah.
I just thought you were talking about like a yogurt.
All my friends are doing that.
Yeah, they're all going to regret it. Please have a follow-up on Kybella about your 4 friends in exactly 9 months. So Kybella is, okay, so millions and millions and millions of people have fat under their neck, right? It's a common area for you to trap fat.
It bothers me.
It bothers everybody. So stop grabbing it. That's number one.
Yeah.
So there's a fat under the neck and we want to get rid of it. We want a nice crisp jawline. So everybody in every company is trying to figure out how to get rid of this fat because, wow, again, I'm talking about $1 trillion businesses. Get rid of scars, $1 trillion. Get rid of the fat under the neck, $1 trillion. So every company, Cool Sculpting, All Therapy, every company is targeting it. Right now, the only way to get rid of fat under the neck is to suck it out, which in many instances can lead to loose skin. So that's a problem. So you have to be very careful. So they came up with this stuff. We're going to call it stuff. It's a drug that you inject into the fatty area in a big pattern all over, and it swells up like a bullfrog. It's massively swollen, and it's supposed to do something called lipodissolve. It's supposed to break up the fat. And you have to do it, and I don't do it, but my understanding is like 6 times or something crazy. Every time you turn into a bullfrog. And many, many, many people have been left with irregularities, a little loose skin. It didn't go away all the way. And I have not, and it's now been around for at least 2-3 years, I have not heard, again, amazing stories. So I would caution people from running out and doing this. Do your homework. People will tell you if it's amazing, but there's a lot of people that are unhappy. Look at this girl, Evangelista, whatever her name was. She did Cool Sculpting underneath her neck, I think, in other areas. And she got this very unusual condition called paradoxical adipose hypertrophy, PAH, which is,
oh my gosh,
instead of fat going away, which is supposed to, it doubles and triples.
No.
Yeah, didn't you read her article?
No.
No.
Oh my gosh.
Don't do it.
That's not Kybella. That was a different treatment. All I'm just saying is I am a big believer of, again, anything that's ungoddamn believable, we all know about it.
Yeah.
There are no secrets in the world. We live in the world of internet, social media. Will Smith slapped Chris Rock, and within 10 seconds, 5 billion people knew about it. 5 billion. The only 2 billion that didn't have it is because their internet was down. I'm telling you that there is nothing in the world that we don't know about. So if Kybella was this like, oh my God, wow, it's unbelievable. I got rid of my fat.
We all would be going.
I'd be there. I'd be the first person to do it.
Yeah. Yeah.
I don't know. I don't buy any of these things.
Yeah. I'm learning so much right now.
I know.
Like, I just love your honesty. This is just amazing and going to help so many people.
Listen, this is my belief. Plastic surgery is fucking badass. It's amazing. You take people, I've given birth for 4 kids, and I used to be an ice skater. You make them back again. You take a young girl or a young boy who's insecure because they have an unattractive nose, it's not balanced. They become the head of band camp. You take an older gentleman or an older woman who's divorced. You do it's awesome. But like all other awesome things, it needs to be done correctly and in the right person with the right intent. And so anything powerful, a gun, a bomb, surgery, if used incorrectly, creates damage. And so my biggest issue today is we went from it being only superstars did it to like everybody doing it by anyone, anywhere, at any time. And we have really gone way off the deep end.
Yeah.
And thank you so much for being so, honest and unhinged. And we love that. Thank you so much.
Thank you.
All right, guys. Thank you so much. Make sure you check out their podcast, Cam and Kary Do Dallas, and follow them on their social media, Instagram at Kameron Wescott. That's KameronWescott. That's a mouthful. And Kary Britt. That's KaryBritt. We're going to be posting links to their podcast and to the social medias in the description. As always, thanks so much for following us. Make sure to share and subscribe and tell all your friends about it. We'll see you next week.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.